Hey everyone, Dr. Morales here. So today is the second podcast for the AMC Movement channel, and we're going to be talking about how the body kind of communicates with the brain and how the body reacts to the different signals it gets. Okay, so like I mentioned before, the brain communicates via the nervous system. The nervous system uses signals such as pain, hunger, sleepiness, that kind of stuff. Okay, it also uses signals like hormones. That's a whole nother beast that I'm not really going to get into today, but that does play a factor, especially for all the ladies out there. It does affect the guys too, but on a very much smaller level. So anyway, so how the body interprets pain, or I guess how you interpret pain can be, very widely, it could be different, okay? It could be, a lot of times people say sharp pain, a dull pain, achy pain. Sometimes people say it's a burning pain, or it's numb. There's just numbness. It's not necessarily pain per se. It's like a discomfort more, and sometimes imbalance. Because if someone can't feel the bottom of their foot, the signals going to and from that area are going to be very garbled, and so you're working on bad information, right? And so you kind of get off balance. So it could also be things like tingles, electric shock pain, or lightning pain. Sometimes that happens as well. The more serious type of pain is the lightning and electric shock pain, just because it's that typically means you're pushing on a nerve. Okay, the tingles and numbness are involving the nerve as well, but it's not really as close to the spinal cord than it is outside peripheral, like a peripheral entrapment. That's essentially what that is where the muscles clamp down on the nerve, and then from that clamped area you get like tingles, sometimes little like spider web feeling like this, things like that. So those are the kinds of signals that your brain is sending out, or your body is sending out, to let your brain know that, hey, something's not right. And so typically the brain will send signals to the area that's hurt, whether it be an organ, whether it be your muscle itself, things like that. So a very small example would be you hit your hand, or you hit your arm or something, you hit your elbow, and you feel a pain, and then maybe a couple hours or two later you have a bruise. Okay, now that means that the brain interpreted that signal as something that hurt the body. The muscles are hurt, so they sent blood to the area in order to heal, because that's how the body heals. I'm sure I have another video on how blood affects the healing process, and so you can go back and check out that video if you want to. But essentially, depending on where it is, the more blood, the better or faster you can heal. And so that's the rule of thumb that the body goes by. So it's going to send a rush of blood to the area. That's when you're going to get an inflamed state. Okay, that inflamed state, you can think of something like a rolled ankle or a twisted ankle. Okay, the brain interprets that as pain, and then it rushes, like something's wrong with the area, so it rushes blood to the area, and that's when you get the swollen ankle. We all know, if you're an athlete, you know that swollen ankles don't keep you in the game. So what you do is you elevate as quickly as you can, slap some ice on there, and don't ever take your shoe off, right? Because if you take your shoe off, then the swelling will just get bigger, and you won't be able to move. Right? You won't be able to move as well. It'll hurt a lot more. And so in that way, the brain is trying to help you not further damage the area. Okay, it's trying to limit the damage at that point. And so, coming back to like a muscle type of injury, like you lifted something and then all of a sudden your back goes like this and you can't move. You have to just wait a little bit until the muscle stops spasming. Now the back has about 5 different layers of muscles, and when the deep muscles get hurt, that really affects a large area. Okay, it's not just going to be this small little unit. It's going to be this unit and any muscles that attach to that area. Notice how I said area, not unit, because like I said, there's different layers, and on each layer there's going to be different kinds of attachments coming from different places. All right, now where was I? So it comes in, it has different layers involving different parts of the body, right? And so when a deep layer is inflamed, when it's hurt, it's going to kind of freeze all of the different muscles around it, and you'll hear this. You'll hear people say guarding. Oh, you're guarding, whether it be voluntary or not. This is going to be an involuntary guarding, which is where your back kind of does this. This happened to me probably about 8 years ago. I don't even remember what I was doing. I was at my mom's house. I must have tried to push something or something like that. I don't know. And then all of a sudden my back just did that kind of thing where I couldn't move. I literally had to kind of like inch my way, to my to an area where I could just relax. But I mean, that's something that is a very real world thing where people I just went to go, put on my sock, and all of a sudden, boom, my back spasmed, right? And so that tells me that you've been nursing an issue for a very long time. It's not just it came out of nowhere. No. Your body keeps score, and it remembers. Unfortunately, it has to remember because, you got hurt a long time ago, and it guarded you. It guarded you from getting hurt more. However, that guarding creates stiffness. It creates, and especially if you've torn a muscle, or strained a muscle, that's essentially more of like I guess it's more of a tear, more of like a pull. Like, have you ever gotten a piece of cotton and just kind of went like this, and then you try to put it back together? Doesn't really work. Sometimes that happens. A muscle strain is more of like your cotton ball getting pulled apart. The great thing though about muscles is that you can rehab them. Okay, we're not all cotton balls where you're just, it's out, oh, that's it. No, that's not it. So you can actually retrain your muscles, which is why rehab is so important. And so anyway, getting back to, when you have that muscle strain, you're going to get a lot of blood rushing to the area. And that is essentially to, what the blood's going to do is going to take away all the dead blood cells, take away all the dead and hurt muscle cells, and then the new blood is going to rush in and resupply with new equipment, essentially. Okay. Now the only thing though is that it supplies it with equipment that is not necessarily from the factory, right? I mean, it is from the factory because you're making the blood, but the kind of cells that are getting laid down, they're not necessarily for that area. And so what they do is I call it scar tissue. It lays down scar tissue to immobilize the area so that it doesn't get hurt more. Okay. Now the only problem with that is that when they lay down the scar tissue, like I said before, it tries to stabilize. And so how do you stabilize something? You just wrap the crap out of it, right? You just wrap. So it's just kind of like, okay, what am I going to do now? Okay. Not move. I'll tell you that. You're not going to move. That way, you just kind of casting the area. Unfortunately, there's a window of time where the muscles, that laying down of all the scar tissue, if you keep it that way, if you leave it that way, the scar tissue will just kind of be like, oh, okay, well, I guess this is how I'm supposed to be. Now, before you got hurt, that area wasn't, just a hashed, I don't know, just kind of there. It's not like They're not. It's a very disorganized way of laying down your scar tissue, of laying down the new muscle, laying down the new equipment. Okay, it's all haphazard. That's the word I was looking for. It was all haphazard, right? And before, your muscles were in line. They were connecting correctly. They were working together correctly. All that kind of stuff. But now that they got hurt, you just threw everything in the sink and the kitchen sink at it, just to make sure that it wouldn't move. Now, within that time, let's say probably about a week or so, after the inflammation goes down, that's when you can get into PT. That's when you can get into physical therapy to rehab that area, to retrain the muscles, retrain the newly laid down foundation, if you will, to bend and not break, but bend and give in ways that will accommodate the kind of movements that you do every day. Right? So if a runner were to, or a soccer player, or anyone like that, any athlete, honestly, who rolls their ankle, let's say it's a grade 1 sprain, strain, something like that. Grade 1 meaning it's not that bad. Grade 2 meaning it's like, torn but not completely torn, and then grade 3 is completely torn, like black and blue muscle. Okay, so grade 1, not that bad, but it still takes you out of the game. Okay, let's say it takes you out of the game. What the person should do is they should rather, ice the area, calm down that inflammation, make sure that they keep the range of motion, as much range of motion as they can. So let's say they can go like this before they got hurt, and now they can only do this. Okay, that's fine. I'm not upset about that. What I would be upset about is if they didn't try and push the boundaries a little bit after the inflammation calmed down. And even when the inflammation is on its way down, then you can start really doing mobilizations, doing ABCs in the air, doing some weighted exercises. If you need to, do banded exercises where you put the band over your foot and you just kind of stretch like that, do some reps that way, using the scar tissue in the way that you would be using it in the game, or in the arena that you're going to be using it in. That will help to retrain that area in order to not you're patching the area, and allowing that range of motion. If you only patch with like plaster, it's not gonna bend and give the way it should. And later on, let's go fast forward 10, 20 years, this athlete who rolled their ankle, like I'm sure many, many times, that wasn't going to be the first time, they never rehabbed, right? And so then they get back into the gym and they try to do a squat. They try and do a squat because they were like, oh yeah, you know what, I used to be the best at squats, and I could probably squat 150 pounds. I don't know, I'm just throwing out a number. I have no idea if that's, a good number or not. But anyway, so they try it, and then they end up, they end up getting hurt, or they end up not being able to go as far down, that kind of thing. And it's because their ankle doesn't have that mobility that it used to. Okay, because they never trained it. They never trained it to be strong in those positions because they were hurt and they had limited range of motion, and they figured, well, I'll figure it out later. That's where my heart kind of comes in, because I was that athlete. I was the one who never rehabbed. I was the one who said yeah to stretching, and now I know better and I do better. But within the time of going to chiropractic college, and even before that, I would try and work out and I would just be in pain, and I'm just like, well, why? Because I used to be able to do this. Like, what happened, right? And so it wasn't until getting understanding a little bit more about why, or what your body does and how it reacts to injuries, I didn't realize how important rehab is and was. I just knew that I just could go to the chiropractor, get adjusted, and it should be fine, right? A lot of times that's what happens, is you can get adjusted and then your muscles will kind of just go back to where they were. I see that a lot with people who have desk jobs, who don't really go out, and they're not typically like athletes where they go and they're on a soccer team, or they play softball, or they go mountain climb or rock climbing, or they go hiking. Actually, hiking wouldn't do too much, but you get the point. They're they're not very rough with their body, right? And so those are the people who, if they get hurt, they tend to have a full recovery because they take it easy on their muscles. They don't, and they try and push the limits without, going ham. Okay. The athletes are the ones who will go ham because they can, because they think, okay, you know what, I'll be fine. I've done this before. It's great. It's fine. But the thing is they don't think about, 10, 15, 20 years, 30 years down the line, when they realize they want to, pick up the game of soccer again, and they realize that, hey, my hip, my knee, my hamstring, my mobility is gone because, I can't, like, I literally can't move that way. And it's because of the restricted range of motion for that many years without rehab, right? They just had a desk job, or they just went to work, or whatever they did, but they stayed in a certain range of motion that didn't retrain their muscles, the hurt area. So that essentially is how pain is interpreted in your body. And so how chiropractic care helps is, with all of the different joints in your spine. There's holes for your nervous system, for each nerve root, if you will. Each side has a nerve root, and then it goes out into, and then branches off into more nerves, and each nerve supplies muscle groups. It supplies organs. It supplies arteries. It supplies let's see, what else is there? Intestines. Oh yeah, it's organs. So I think I, listed everything, but it supplies everything in your body. And when there's, let's say, someone stepping on the hose, i.e., a muscle that's really super tight, it'll clamp down on the nerve, and the flow of communication back and forth is it's diminished. And so I always say that the brain can only do so much based on the information it gets. So if you're getting garbled information, then what you'll get is garbled output. You'll get maybe not misinformed, confusing signals. I see this a lot where people say, well, it's a sharp pain, but it's a dull, achy pain too. It's right here, but then it also goes over here. That's what happens a lot with visceral pain. Okay, people say, oh yeah, everyone knows the heart attack thing, right? When people have hard time breathing, and all of a sudden they go like this, and then they fall over, right? That's typical, like, movie stuff where people they have a heart attack, and that's what happens. And this right here is because their heart is on this side. It's on their left side, and the left arm is basically what's served first, besides the head and neck, and goes down, it goes this way too. And so when that happens, or when that doesn't happen, I should say, the brain interprets the signals as starved oxygen. It's actually starved oxygen from the muscles, and the muscles interpret that as pain. And so when the person goes like that and then falls over, that's been something that's been building over the last 5 minutes or so. Okay, and so I know a lot of people say or know that the brain can't really function or come back fully functional with let's say 4 to 6 minutes or something like that without oxygen. It's probably a lower amount. Don't quote me on that, but essentially people know that, right? If you're deprived of oxygen for so long, for such a period of time, then the brain dies. It's not as serious with muscles. Then you're gonna die. It's not like that, but but you can understand that limited oxygen to your muscles, limited oxygen to or nutrients, I guess, with into your organs, excuse me, that will produce pain. It'll produce a dull, achy pain. It'll produce a weird, flutter in your muscles maybe. I've had that happen before. For example, let's say your gallbladder is inflamed. Okay, your gallbladder is inflamed, and I don't know if anybody, so just for reference, if you go right to your diaphragm right here and then follow your right rib cage down, right in the middle, like if you go into your clavicle and go into the middle and then go straight down, right under your rib cage, that's typically where, around the area where people's gallbladders are. Okay, and when the gallbladder is inflamed, it'll send signals, pain signals, like this is not right, something's not right, to the brain. The brain will then send signals to to the area, and a lot of times people will have pain like right in here, right in their back, right in here. Okay. Unfortunately, the brain is not as great as it should be, I think, in telling you exactly where the pain is coming from. So if you're having a gallbladder issue, sometimes you'll have pain coming around here, or even it'll start in the back. More serious issues, and this is not to scare anybody, but this is just another example for women. When women are having heart issues, not necessarily a heart attack, but just heart issues, sometimes their pain won't be right here. You won't get any pain in here like guys do, like males do. A lot of times what the women will get pain right in the back, opposite of the gallbladder. Okay, so basically right next to your left shoulder blade. And so they'll just say, oh, my back hurts, my back hurts, my back hurts. It's probably because I carry so much weight in the front. You good ladies, you know what I'm talking about. And so they just chalk it up to that, right? So, if this is a recurring thing that, you get adjusted and it feels better, but then it comes back right away within hours, then the chiropractor or the doctor, whoever is looking at you, should take a look at your heart. They should take a look at your blood pressure. They should look at your labs and make sure that your cholesterols are okay, that your other nutrients in your body are good, because that could be a sign that you're having some heart problems. So things like that is very important as a chiropractor to know, because visceral pain can manifest as spine pain. It can manifest as low back pain. For example, another example would be, let's say you have a UTI. Let's say you have low back pain. You don't really put it together, but you're having a little bit of burning while you go use the restroom, and then all of a sudden you have some back pain too. You go to the chiropractor and you say, hey, my back hurts, what's going on? And they're like, oh yeah, yeah, it's low on the left, sacrum's out, low back's doing okay, let me see, actually right here, in your mid back. They go up to your mid back, in the TL junction area, thoracic lumbar junction area, and they say, oh, that is actually pretty out, you doing okay, what's going on? And they're like, oh yeah, it's just same old stuff, right? A good chiropractor will say, hey, do you have any burning while you're going to urinate? And if you say yes, then they'll say, okay, well, wait a minute, this might actually be a UTI that you're feeling in the back. Okay, because your kidneys are right above your hips. So if you can feel the bone of your hips on the sides right here, and then follow them back a little bit, again, right in the kind of the middle part, right under your rib cage. Well, I guess I should say right below your rib cage, not under it. Those are where your kidneys are, right? And so the kidneys are actually not as deep in your body as people might assume. I know I didn't think that they were this close to the outer part of you. So if they are very inflamed, what could happen is the doctor, the chiropractor could do a test. Okay, it's kind of called the kidney punch exam or kidney punch test. So what you do is you put your well, I guess I won't go through it, but essentially they see if it's inflamed, and if that's the case, then they might refer you to get a urinalysis done to make sure that you're to see if you have a bacterial infection. Okay, because if you do have a bacterial infection, those kinds of things can produce not only low back pain, but it could also produce a fever left long enough. Okay. And so, like I mentioned before in my last podcast video, if you don't move, even like on the micro, cellular level, bacteria will grow. Bacteria will invade, and just be one more problem for you, that you're gonna have to take medicine, and that comes with a whole new set of issues that you need to keep an eye out for. All this to say is that, pain is a great way for your body to communicate. It's just a matter of you interpreting the signals correctly, and seeking advice on all these different kinds of pains. Lightning, electric shock pain, numbness, tingles, dull, achy pain, sharp pain, radiating pain. If there's a radiating pain, meaning it goes from one, you can pinpoint it from here, and then all of a sudden it goes down to your, forearm. Those kinds of things are very important for you to explain, and see if you can show it, because it'll tell the doctor, whoever you're talking with, it'll tell them a lot. And so understanding how to communicate with your doctor, understanding how to communicate what you're feeling is very important. And having patience with yourself, understanding that, sometimes, I actually see this a lot with kids, even some teenagers, like younger teens, like 13, 14 years old and younger. It's tough for them to understand, what is pain. Should I be, like, I shouldn't be feeling this pain. I remember when I was, in high school, looking back, I'm pretty sure I had a disc bulge, but I didn't know it. I didn't know how. I just said my back hurts, right? And I had some patchy numbness in my left leg, on my calf, on my, like, the front part of my leg. Now I know that's evidence of a disc bulge, right? And so, but I kept playing, and because I didn't interpret the signals correctly. I didn't know what to say. I didn't know how to explain what I was feeling, or that it was even important. And so, that's why I like to do these kinds of videos and informational things, because, the people need to understand that pain it's not that it's not normal, because it is normal. That's how your body communicates. It's not normal to be in pain perpetually. Okay? It's not normal to always have, this one thing that happens. Okay? Because if that's the case, then it's kind of like someone saying, hey, can you not do that because XYZ? And then all of a sudden the person just keeps doing it and keeps doing it. They just say, sorry, my bad, but then they keep doing it. Well, you're kind of doing the same thing, but with your body, when you don't change the behaviors, when you don't adjust your behaviors to what's happening, right? So for simple things like an ankle roll or something like that, you're going to rehab yourself and ease into weighted training. Things more serious like a heart attack or any kind of heart issue, you're going to change the way you eat, right? Same thing with things like diabetes. When you are diagnosed, or if you are diagnosed with what's called metabolic syndrome, that is a precursor, what's called a precursor to the full-blown diabetes. I think I'll do another video on diabetes in general. I think I've already done one before, but I always like to keep that in the forefront of people's minds, because it's such a prevalent disease that is very, very manageable and very, very reversible, depending on when you catch it and depending on the person. If the person doesn't want to change their ways and change how they eat and change their mindset, then congratulations, you just won a lifetime supply of insulin, right? And sorry to say, but that's that's the kind of thing that will happen. You'll be dependent on insulin because you never gave your body the chance to change. You missed the window to change. When people have that window to rehab themselves, for example, that ankle roll, and they do it, sometimes they come back even stronger, right? Because you were able to give that time and attention to that ankle, to that knee, to that shoulder, right? To that wrist, to rehab, to get stronger in the weaker parts of the motion. So, like I mentioned before, to kind of, wrap things up a little bit, pain is a really good way of your brain, of your body, I guess, to communicate with you. Now, understanding how to interpret those signals it can be difficult. It can be perplexing at times and frustrating maybe, but that's why, people like me are here to help and to help you interpret the signals, to help you understand what is the root cause of these signals getting thrown, and how to avoid them, and how to be better, how to adjust your lifestyle, give you mobilization, tools like stretches or exercises to strengthen certain areas, and then to stretch certain areas, right? And so that is pretty much, I think, what I wanted to explain about pain. I guess, shoot any questions that you have in the comments. If I, kind of skipped over something, or if I didn't explain something well enough, or if you're still confused about something, please, don't hesitate to ask. I love explaining these kinds of things to people because I didn't understand it before, and now that I understand it, it seems very easy to me to understand. But I really enjoy explaining these kinds of things and giving examples, real life examples, because I've been there, I've done that. So yeah, all right, guys, enjoy the rest of your day.